All right, so we're going to talk about HIV and AIDS. This will be a little bit of a quicker lecture, I'm thinking. But I do want you, so I'm not going to show you this video in the lecture, but I do suggest that you go and watch it. It'll give you some good information about HIV and AIDS. All right, so where did it come from? A lot of people usually say like, oh yeah, monkeys. Well, it did, but it does not mean that humans had sex with monkeys. So let's get that out of the way. It came from West Africa. Humans were hunting chimpanzees. They came in contact with their infected blood. And so with the mutation to that, it eventually became HIV for humans instead of simian, which is the chimpanzee SIV, simian immunodeficiency virus. So now it's HIV. All right, so it's a virus, so just know that it won't go away. It's going to stay in your body. This virus attacks your immune system. So if you don't know you have it, which is very likely that you wouldn't know you have it if you're not being careful with sexual activity and even drug use, I'll get into that in a minute. But if you don't know you have it, it just continues to work in your body and your immune system and can become very dangerous for you. AIDS, just think of it as like advanced HIV. It's not something you want to be advanced in, but basically if you go from the stage of HIV to AIDS, then basically like you're not going to live very long. So yeah. We're going to talk about opportunistic infections in just a little bit. So modes of transmission. So these are the 4 fluids, bodily fluids that you can transfer HIV through: blood, semen, vaginal fluids, and breast milk. It was once said that like breast milk was safe, but through further studying and research, it's not. Okay, so this is where I mentioned drug use. So a lot of people, especially when they want to just get high, they don't really care about sharing the needle. And if it's not a clean needle and someone is infected with HIV, then that definitely puts them at risk of getting it through the needle. So it's not just transmitted through sex, because people are shooting up, doing heroin or whatever, and they're getting HIV through that way. Just remember that there are different kinds of sex and they will all put you at risk. So vaginal, oral, and anal. The mother can give it to her baby different times during pregnancy. So during pregnancy, during birth, during post or after birth, which is postpartum. 3 out of 10 HIV mothers will pass it. Something that's interesting is that babies will have their HIV-infected mother's antibodies, even if they're not infected with HIV. So it's important to test them about 18 months after birth, because if you test them right after, then they probably will test positive even if they don't really have HIV. So with technology and medical advancements, there's ways for the mother to prevent giving it to her baby, which is awesome. So the mother can take certain anti-HIV drugs, delivering C-section or cesarean section, so not vaginally, that can prevent it. The baby can be given anti-HIV drugs, and then, of course, since we know that it can be given through breast milk, the mother would not want to breastfeed and just do formula. Just understand that HIV is not spread through these things. There's the very extreme, like super outlandish things where like you decide to be blood brothers or something and you shake hands. Basically, you understand that a virus spreads, like it's got to go into your blood system, like your into your system. So if you have an open cut and you shake hands with someone that has an open cut and blood is exchanged and one of you is infected, then yeah, you're going to definitely be at risk of getting HIV. In the video, if you decide to watch it, it mentions light kissing, and that's because there's like very, 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 very small amounts that have been found in saliva. So you've got to like try to be breaking the world record to pass it through kissing. So it's not going to happen. Doorknobs, like I mentioned before, very, very outlandish kind of scenario. If there's blood on the door and you have an open cut and you touch it, I mean, it's very stupid, right? Understand that the virus needs a host to survive. And we're kind of have talked a lot about that with the coronavirus, unless you've been living under a rock. But yeah, so the virus won't live outside of a human or like a host for very long. I mean, it can live for a few days depending on the surface. So just know that, like, yeah, like if it's like dried blood, it may not be risky, but there's always a risk. Okay, and then, I mean, toilet seats, unless you have a cut on your butt. Don't sit down on the toilet if there's blood on it. That's disgusting, though. Okay, so there's some very extreme, dumb situations, but it's not going to be spread through those ways. All right, so HIV is going to attach to the cell surface. It's going to enter the cell, go to the nucleus, and then basically just multiply and become the virus factory. So that's how it works. That's how the virus works. 4 stages. You're going to have the primary stage, which, if you look at these are kind of like symptoms that a lot of people get, flu-like illnesses. You can still infect other people without knowing it. The asymptomatic stage, asymptomatic is showing it's no symptoms. The A in front of a word like that usually means without, so without symptoms. Lasts for an average of about 10 years, which is kind of interesting because you may not know you have it, but the virus is still working in your body. You can detect it in your blood if you decide to get a test, though. And then the symptomatic stage, you're going to start to show symptoms. At this point, your immune system is pretty weakened. An opportunistic infection is basically like someone like with a healthy immune system. They have a pathogen like bacteria or some other virus that enters their body, and their immune system is strong enough where they can fight that off. But an opportunistic infection is where, like, you don't have the immune system, so like the smallest thing like the cold you can't really fight off. And then stage 4 is when it goes from HIV to AIDS, which basically is like you're going to die from AIDS. Well, okay, let me actually rephrase that. You don't die from AIDS, you die from having an immune system so weak that you can't fight off illnesses and diseases. So just understand that, like, you're in the AIDS stage, but there's a lot underlying, like with what actually takes your life. It's not AIDS itself, it's your immune system is basically non-existent. Okay, so anonymous testing, your name is not going to be used. You're given a number. The results will be given with, tied to that number. There's confidential testing. Your name is recorded along with the results. If there's positive results, it's going to be reported to the State Department and the Centers for Disease Control. It's not like they're going to go announce it on Channel 2 News or whatever. You're going to be given the results, obviously, and then the State Department and the CDC. Different ways to administer the tests: blood, urine, and oral. These are just blood tests. You don't have to know those. Different ways to test through the blood. And then the urine is another way that you can test. Something that's interesting about the urine test is that it can create a false positive, which means that it tells you that you have it when you don't. I don't know how often that happens, but I think it's generally people that are at higher risk for HIV. The oral test is not a saliva test. It's kind of, in a way, kind of like a blood test because they take blood-derived fluids from your gum tissue. So that's the oral test. 4 ways to protect yourself: abstinence, 100% way, remember, to prevent diseases and pregnancy. Monogamous, this is one. You guys have probably heard polygamous, which is multiple in a relationship, right? So monogamous is just you and your partner. And let me add to this, mutually monogamous. I have that written, I have it right here. It means like both of you are like faithful to each other. Because if you're in a monogamous relationship, but like someone's cheating, then yeah, that's not mutually monogamous. Protected sex, and then sterile needles. Ways to protect yourself. So, all right, there you go. That is HIV and AIDS.